Joining us now is Dr. Paul Offit, the director of the vaccine education at the Children's Hospital of Philadelphia. Doctor, we just heard the former immunization chief at the CDC say, quote, he only sees harm coming. And I'm wondering, do you think that's hyperbolic? Do you think that's an exaggeration? Or do you agree with that assessment?
I agree completely. I mean, look what's happened just over the past year. We've had the biggest measles epidemic we've had in 33 years. We had 2 children die of measles, which we haven't seen since 2003. We have 266 children die of influenza. We haven't seen numbers that big since 2009, the swine flu pandemic. And we've had 10 babies die from whooping cough. The previous year, we had 2 babies die from whooping cough, and this year isn't over yet. This is getting worse and worse, and I imagine next year will only be worse because we have a Secretary of Health and Human Services who is a virulent anti-vaccine activist and science denialist. Why would we ever imagine this is going to be getting better?
Doc, I also want to read you what these former CDC directors kind of laid out in their New York Times op-ed, kind of about what they say are the wide-ranging impacts on America's health security. They write, residents of rural communities and people with disabilities will have even more limited access to health care. Families with low income who rely most heavily on community health clinics and support from the state and local health departments will have fewer resources available to them. Children risk losing access to life-saving vaccines because of the cost. This is unacceptable, and it should alarm every American, regardless of political leanings. Are there other impacts not mentioned in that list that you see could really be a problem and a strain on America's public health care system?
Here's what worries me the most. I think right now you have a Secretary of Health and Human Services, Robert F. Kennedy Jr., who will make vaccines less available, less affordable, and more feared. And so I imagine that these outbreaks that we're seeing are only going to get worse. What scares me the most is we're not going to know about it. That because the CDC has been shredded in many ways by these cuts, that we're not going to have adequate surveillance to let us know how many children are suffering this and where the high-risk areas are and where we need to focus our immunization efforts. That's what worries me, that it's going to get worse and that we may not really understand it.
And, for some of these less serious issues, it just strikes me the threshold for health care in so many places, even frankly somewhere here in like D.C. where it's very difficult to get even a primary care appointment. The fact that you can't maybe get this vaccine at your local pharmacy, the fact that you can't get it more easily, your insurance won't cover it, just the barriers that this creates for people who are pro-vaccine and would like to get care, is that going to exacerbate the spread of these diseases?
And I hear from these people all the time. From pregnant women, for example, who would like to get a vaccine because they know that pregnancy is a high-risk complication for severe COVID, that if you look at pregnant women, they are 1.5 to 2 times more likely to be hospitalized and to be admitted to the intensive care unit and be mechanically ventilated than women of the same age, reproductive age, who have COVID but aren't pregnant. They want to get the vaccine, and they're having trouble getting it because Robert F. Kennedy Jr. stood up and in a 1-minute video on X said, we no longer recommend the vaccine for pregnant women, thus ignoring all the data and making us the only country in the world that doesn't consider pregnancy to be a high-risk situation for severe COVID. So, and that's just one of many examples.
I also want to ask you about something you just touched on, and that's facts, medical information. Separately, we had the former CDC director, Tom Frieden. He was with the Obama administration. He spoke with our colleagues on the Weekend Primetime. I want you to listen to a little bit of what he had to say.
I never thought I would see the day when you couldn't trust what's on the CDC website, but that day has come.
I mean, that's a big issue. If Americans can't trust the information on the CDC website, where should they be going for easily accessible medical information and guidelines now?
So I think right now the professional societies, like the American Academy of Pediatrics, to get good information about childhood vaccines, or the American College of Obstetrics and Gynecology to get good information about vaccines in pregnancy. But right now, I agree with Dr. Frieden. I think that we can no longer trust the CDC. We certainly can no longer trust the Advisory Committee for Immunization Practices because Robert F. Kennedy Jr. has stocked that committee with people who really aren't experts in the field, don't have expertise, and aren't going to be giving us very good advice.
Dr. Paul Offit, certainly giving us a lot to think about. Thank you so much.
Thank you.